In this video today, I would like to show you the protocol that I use for people to use the Armaid at home when they have evidence of median nerve compression, aka carpal tunnel syndrome. The median nerve is often blamed for being compressed at the wrist, and it certainly can. But the median nerve has a path that starts in the neck and has to travel through a variety of structures where it could be compressed long before it reaches the wrist. So we find out that we get our best results if we have people do their own soft tissue therapy at various places along the path of the median nerve where it's likely to get entrapped. I have circled the 4 areas we are going to treat with the Armaid. We're going to treat the transverse carpal ligament, which is the ligament on the front part of the wrist here. Now note it's below the crease. It's not here. It's really already into the hand. The second spot is the tendons of your finger flexors. You can feel them usually. They're pretty tight right here. This third spot is probably the most important one, the one where we find the most problem. It's called the pronator teres. It's a muscle that has 2 bands in this direction, and they flex and they turn the arm in. And the median nerve often has to traverse either underneath or actually through the 2 parts of this muscle. The last one can be a problem in some people. It's a little harder to treat with the Armaid, but we still can get to it, is the place where the median nerve traverses underneath the biceps before it crosses into the forearm. We're going to treat the median nerve from the wrist up. So for the wrist, you typically will have to set up your Armaid on the smallest setting, and please refer to the first video on the general use of the Armaid. You're going to place the middle roller right over the dot, right over the transverse carpal ligament, and you're not going to travel a whole lot, and we're going to do 5 to 10 really deep roll, intense pressure, maybe a tiny bit of pain. Good. The second spot, we probably will need to open up the Armaid. Depending on the thickness of a forearm, it's either going to be 2, possibly 3 notches. We're going to aim in the middle of these finger flexors. We're slightly going to extend the hand, and we're going to go down very deep and slow 5 times. Notice I don't rush this. I really want to work those tissues that get chronically tight and scarred. And at the very end, we do what's called a return pass to bring the debris up the arm for the blood flow to capture all the debris. And we're going to go in the other direction. Third point is the pronator teres. It's tricky. Pay attention. You may have to go up 1 notch. I don't think I'll need to in my arm. You're going to find this area, and often it will be tender, and sometimes when you push on it, it'll trigger the symptoms in your 3 fingers. You will need to start a little above the black dot, like almost at the inside elbow, what we call the medial epicondyle, and you're going to roll down into this muscle, following the angle of the muscle. It looks like this. I'm going to start a little bit above. I'm going to extend my wrist, and I'm going to go down and towards the outside of my arm, maybe 3 inches. 5 deep passes. If you reproduce some of the tingling on your hand, you're definitely on the right spot. I'm going to go 3 for the sake of demonstration, and we always are going to do 1 return pass back up. The last spot, if you feel that it's an area of symptom trigger, it's a little trickier. You have to slide your arm this direction, and you're going to go above the elbow into this muscle. And we're going to go up. It's very difficult to go down in that area. Deep on the outside part of the biceps, so we're rolling up this way. I recommend people do this once a day, no rush. And if you have any questions in the office, will often help the patients locate the points on themselves. I hope this has been helpful. We'll see you in the next video.